you for the welcome. I'm going to share my screen. No. Can I get a thumbs up or a thumbs down or a something if it's not sharing? Okay, great. And I'm going to turn off my video as I'm presenting just because I've been having internet problems and want to minimize the possibility of the internet crashing. So, so yeah, my name is Susan Cadell. I live in Kitchener-Waterloo, the city of Kitchener, and work in the city of Waterloo, which is off the map that was shared with you briefly. And I live on the Haldimand Tract, which is a large swath of land on either side of the river known colonially as the Grand River, that many would like to rename or go back to its original name of Willow River. It was promised to the Six Nations, and remains the traditional territory of the Haudenosaunee, the Anishinaabe, and the Adirondack peoples. And currently less than 5% is actually in the hands of Six Nations. So I live on stolen land, and I am white, I'm aging, I'm semi-retired, I am able-bodied, I am cisgender, and I have been gifted with the title of being queer adjacent by an indigiqueer friend and colleague, and that is a term that I embrace as I have several family members who are queer and trans. And I have written about how grief found me, about the ways in which grief came into my life at an unexpected time, and began what then basically it began in my personal life, and I launched it into my professional life. And so I've written about that in this blog post. So I would invite you to read more if you feel like it. So today we're going to, I hope that by the end of the session, you'll be able to, if you're not already able, define grief and loss and bereavement, engage with the normalization of grief support, understand how grief is changing in Canada, and also describe a grief literate world, among other things that I hope you'll come out with at the end. And most of the presentation is going to be following along this article. Oh, I've cut off most of the reference. I'll change that before sending out the slides. But we've published the protocol that we had. The protocol for the study that we had funded by the Canadian Institute of Health Research, with all of the folks who are listed on the screen involved in it, several of whom are your colleagues in the North, Holly Prince and Kathy Cortez Miller, among others. This article is freely available, so you should be able to download it with the link. And if you're not able, you can always let me know and I can send it to you. So I'll talk more about that later. So starting off with the basics, I just want to start by defining grief, and I want to sort of also declare that that these are my views, that these are my biases, that this is my point of view, and you might not agree 100% with everything that I have to say, And that's totally fine, and I'm always happy to talk about that. Um, that's it's important that we all have a better understanding. And so I understand that as my point of view. So grief is the reaction to any kind of loss. Loss is all kinds of things. Loss can be the loss of opportunity, the loss of a job, the loss of a relationship, the loss of a pet, any kind of loss where something happens to us that we didn't expect. Grief is the reaction to that. And bereavement is the term that's used after people die, so after human death. And I say human death because often when in the media, when you see death, it means humans. And so when you see, for instance, reporting on a disaster and it talks about the death toll, that's only of the humans. And yet for instance, the loss of animals, the loss of pets, the loss of farm animals um, can have a huge impact on the humans as well, which can cause grief. So, I think it's really important that we be clear about the terms that we're using. I don't use bereaved very much. I don't think we really need to differentiate that necessarily. And there's also the term of mourning, which is the expressions. And I just, I also speak French. For those of you who speak French, there's only one word in French, and you sort of use it differently for aspects of grief. So I tend to just use grief as a global term um, for everything that occurs around loss and reactions to it. So, and I also want to touch on the importance of the idea that grief is far more than just an emotion. So it is a reaction, it is a physical reaction. There are now books on the grieving body and the grieving brain, and people doing research around what the changes are in the brain during grief, and aspects of mortality, how much more likely you are to die of a heart attack when you're grieving, and things like that. So, there are definitely physical impacts of grief. There are spiritual impacts of grief. I've almost never met someone, and I've talked to a lot of people about grief in their lives, who haven't engaged spiritually, which may be religious and may not be religious, but it definitely has spiritual implications. It has social implications and relational implications. So it changes our relationship. It changes our relationship to ourself. For instance, the term widow or widower, there's no equivalent term when, widow or widower is used when you've lost a spouse, when a spouse has died, but there's no equivalent term when a parent has a child who dies. And then we don't differentiate between um, the death of a child who's underage versus the death of a child who's an adult. They're still our children. So all of these things are social and relational and have huge, huge impacts on the grief and our relationship to the person also has an impact on our grief. One of my pet peeves is the term loved one. We especially when someone's ill, or they're in long-term care, or they've died, people tend to use the term loved one in relation to that person. And I really hesitate. I encourage people to think about that term, because our human relationships are so much more complex than just love. Um, we have uh, we have relationships that can be very, very complicated. And so, for instance, someone who is adopted, or someone who is in an abusive family, they still may grieve. Any of those people still may grieve the death of someone in their family, even if they didn't love them or if they had other feelings in addition to love. So I really, that's that again, that's one of my pet peeves and one of the aspects of my thoughts about grief, that may or may not jive with everybody, but I think the point about the loved one and the use of the term is to think about the words that we use and the language that we use. It's really, really important. This is just a few images that portray grief. Grief is heavy. Grief is absence. So the statue of the chair that's absent. I can't remember where this image came from, so I can't give it credit. But the the stones in the body is the rising cairn, and um, I don't know the origin. I haven't actually seen it. I don't know if at its origin it was meant to depict grief, but it depicts grief really, really well in terms of being really heavy. And I'll talk more about absence in a minute. And we our understanding, our scholarly understanding, our societal understanding of grief has evolved. And in the literature, in the scholarly literature, it used to be about detaching, that kind of Freudian idea of detaching, the idea of grief being time limited, straightforward or linear, and that those are all aspects in the literature that it's not difficult to find. And I think there's also a notion that grief is the same for all. And now we have a better understanding that grief is lifelong, that it changes over time, that it's very, very individual. And for some, they call that messy because there isn't predictability. That it is definitely culturally and socially determined, and that religion and race and all kinds of factors help determine how people grieve and how their grief is received. So much more complex ideas around grief. We have complex models. I'll touch on that a little bit. And our newer understanding also includes the idea of continuing bonds and continued relationships with people after they die. So I am particularly biased. Another one of my pet peeves is seeing the 5 stages of grief. And it's not that it was originally developed for, Elizabeth Kubler-Ross did a great deal of amazing work. She did very important work around the stages of grief when people are facing life-limiting, life-threatening illness. And the stages actually make a lot of sense in that context. They don't make a lot of sense in the case of grief and grieving the death of a person. And it basically is an idea that took on a life of its own, and it's not hard to find 5 stages of grief um, in the scholarly literature, but also in the popular literature, in books, in films, in TV shows. Um, and yeah, it just Taylor Swift. I don't know. Taylor Swift organized her own career into 5 stages, which may or may not have been a nod to the 5 stages of grief. But I think it's really it's an idea that had its time, and I would like to really see us kind of universally pushing back against the idea that that there are 5 stages. I know that there are. I have friends who are grief counselors who have people come to their office and say, I'm not grieving correctly because I haven't done X or Y stage of grief. And so it's really, really important that we um, that we understand that that's a really outmoded model. So if it's an outmoded model, what is more accurate? My personal favorite is this very complicated model by Strobe and Schott and Strobe, that's referred to as the oscillation model because it has the oscillation in the middle. Um, and it's this notion that people sort of are in grieving, that people are oriented towards loss, and they're oriented towards restoration, and that they go back and forth between those kind of randomly, and that even within each one of those loss and restoration orientations, that there's both positive and negative aspects. And so it's a really complex model. There's nothing simple or straightforward about it. And it's, in my mind, a much more accurate representation of how we experience grief for the most part. It's applicable. I think this is how children often grieve. And you know, it can be really affirming for adults to understand that, you know, that what they're feeling with this kind of going back and forth and is part of the experience. And it's really important to normalize that. So that's my personal favorite. There are other models of grief, but that's my particular favorite in terms of what it's supposed to look like. To be fair, it hasn't been tested outside of the kind of, to quote unquote, norm. I'm making air quotes as I say that. The bereavement literature, the grief literature, the bereavement literature in scholarship is filled with mostly middle-aged, cisgender, heterosexual white women, a little bit of men, but there's very, very, very little diversity in the experiences that are documented in the scholarly literature. And so, you know, these kinds of models, it's really important that we test them in different other cultural groups than the ones that they've been kind of conceived in, which are those. This is actually based in Europe, but that kind of European colonial notion of white middle-age experience. So, you know, it's really the newer scholarship is taking on that testing. Well, the other piece that is a newer understanding of grief is the notion of continuing bonds. And in my mind, this portrait, which was painted just before or just after, they're not sure anymore, the littlest child died, is a really good representation of how our bonds continue after death. So the four surviving siblings in the foreground, you know, would have a lifelong relationship with their smallest sibling. And, you know, the idea of continuing bonds is that we don't detach from people. We develop a different relationship, that that death doesn't end a relationship. Death changes a relationship. And so continuing bonds is a really important notion. So grief support, again, is, I want to normalize grief support. I want to expand and push at the boundaries of grief support, especially in social work. And I think in many instances, when we say or hear grief support, we mean professional support. And I think it's really, really important that we understand that grief support is much bigger than that grief support can and should come from friends and family, from networks, from faith communities, from neighborhood associations, from cities, from governments, should come through education at all levels, including national education, public education, um, and as well as coming through professional and volunteer sort of therapy and support. It's not to say that that's not important, but I think it's really important that we don't understand support to only be those who have credentials. That we need to expand the idea that we all provide grief support. We all are capable of providing grief support and normalizing and expanding that idea of grief support. So further, grief is changing in Canada and in the rest of the world, but in Canada particularly, we have basically almost a decade now of medical assistance in dying, and we have a deepening drug poisoning crisis. We had COVID-19 and all of the after effects of that. And there was a lot of talk in COVID-19 of an increased awareness of grief, which is when the Canadian Grief Alliance began, and that put plural because now there's other grief alliances. So two things. So there's an increased awareness, which was great. There was much more media. There was much more. There were more headlines, some of which were saying that there was definitely going to be more grief happening because of COVID-19, which, yes, I'm sure it was happening. But again, like the idea that grief support only comes from professionals, often the underlying message in some of those messages was that we were going to see more prolonged and sort of disordered grief, which brings me to the next point about prolonged grief disorder. So this is, a disorder, and it's an outcome that means severe and persistent grief that interferes with functioning, quality of life. It can cause a lot of distress, inability to work, impaired social functioning, increased risk of suicide. And this prolonged grief disorder is something that lasts a long time, as in the name. And I think it is very, very important to understand that this exists. And I think it's also really important to contextualize it and to, like any discussion about language, that we be aware of what we're talking about, that not everyone has prolonged grief disorder. It does happen, and again, I'll touch on a few sort of numbers in a minute, but it is the minority experience rather than the majority experience, so that's really important. Grief literacy is a term that existed in the literature, existed in the wild, as I call it, for many years. There's a number of people who say that they've coined the term. This group that I'm part of, with Lauren Green and others, we went looking for a definition and couldn't find one. And so we took it upon ourselves to define it. So what we did, we defined grief literacy as an individual's capacity to access, process, and use knowledge regarding the experience of loss. It's a multi-dimensional capacity that comprises knowledge, skills, and values, and the dimensions connect and integrate because individuals are interdependent and they live within sociocultural contexts. So we, found the term in the literature, couldn't find it defined. We defined it, and then we thought, okay, how do we get there? And then we realized that we didn't know what there looked like. And so we asked ourselves what a grief literate world would look like. And so this article that's mentioned here at the bottom, the Breen article from 2022, again, it should be freely available. It's a call to action for compassionate communities, so I'll talk about that a little bit, but it includes 12 vignettes that illustrate a grief literate world. So I'm just going to share a few of those with you. If I can get my slide to go forward. So how would we know if we were grief literate? Here's one example. Phyllis hires Bill, an Indigenous speaker, to address her class by telling his people's story, focusing on resilience, intergenerational grief, and trauma. The students appreciate hearing the personal side of what is already covered in their assigned textbook. So grief literacy is about far more than just death. This particular vignette is trying to illustrate intergenerational grief, the overlap with trauma, and demonstrate that if we lived in a grief literate society, we would be teaching in our school systems, in formal education and informal education, about the realities of peoples in the case of Canada, the Indigenous peoples, and we would be already doing those things. And so so in this vignette, hiring someone, paying people what they're worth, not expecting people to take on labor for free, brings in a personal point of view for something that's already being taught. So this is one illustration of a grief literate world. Another way that we would know if we were living in a grief literate world is about Carlos, who's 12. With the anniversary of his twin brother's death approaching, his football teammates are more attentive to Carlos. They notice that, despite the heat, Carlos will only wear long-sleeve jerseys. Worried that Carlos might be self-harming, the teammates approach the coach for advice. So in this vignette, we're trying to illustrate, A, that children grieve, B, that children can be aware of that, and can be attentive and support one another. Look at the support that's going on in this vignette. They're watching out for their teammate. They know that an anniversary is approaching, and they are concerned when they notice something that is not the norm for their friend Carlos. And so they, approach an adult to see what to do about that. And I wanted to share one more vignette. So there are 12 in the article, but this vignette, because you're a group of professionals, I thought you might particularly appreciate this vignette. Jen and Britta have just met at a barbecue. Jen asks Britta about her work, and Britta says she is a counselor who works with people bereaved by suicide. Britta is confident that disclosing her work will be met with an affirming response from Jen. Jen responds, "Oh, I've never done that. Tell me more." I would, if we were in a room, I'd ask for a show of hands for anybody who's ever had this experience. I myself, I work in grief now. I talk about grief a lot. I used to work in sexual assault. I was often confident that my disclosing my work would not be met with an affirming response. I was often confident, and I still am often confident, that disclosing what I do will be met with silence, will be met with oh, and a changing of subject. There's lots of different ways that this vignette, it would be nice as professionals if we all could be confident that talking about our work would be met with an affirming response. And I have to tell you that when the group that originally wrote these vignettes, we presented the vignettes to a bunch of our colleagues. They all laughed when we read this vignette out loud because they knew it was far from their experience. These were all colleagues who did some kind of grief and bereavement work. So again, there's lots of different vignettes that touch on different kinds of loss in the article, and I would invite you to try to have a look at that. So which brings us to the public model of bereavement support. So I've kind of hinted at this a little bit. So these are colleagues in Australia who thought about in their system of palliative care, everyone who experienced a death, which was 100% of people in palliative care, had 100% of the networks, and everyone was being referred for counseling, and they realized that that was just not the best approach. That was just not going to work. They didn't have the resources to support that, and so they decided that they needed to figure out a way to kind of sort of not justified, but to streamline services and to figure out who's most in need of services, or who is most likely to benefit from services. So they theorized, which is the black percentages, that only 10% of people would be at high risk of complicated grief. So think back to that slide a few moments ago, where people are basically paralyzed by their grief. They thought that about 10% of people would be at high risk of that, and that those are the folks who might benefit most from a referral to professionals. When they tested it, it was about 6.4%. So the black percent is what their idea was in the beginning, and when they tested it in Australia, the red is there, and this is pre-COVID, just to be clear. The red is what they actually came up with. So it wasn't too far off. Then they also thought about moderate risk. So these are people who are at moderate risk of complicated or prolonged grief. And these are folks who might benefit from some additional support in the form of peer support or volunteer-led support groups. And that 60% of people were at low risk, and that the majority of those folks would deal with their grief with the support of their network, so their family, their friends, their neighborhoods, their faith communities. So that's what they thought about. They tested it, and the Ireland has done something similar. And from my understanding, the Hospice Palliative Care Ontario has picked up Ireland's model and is using it now, without actually referencing this original model, unfortunately. So, but this is the original model. And here's what I want to tell you about this. What is really, really important, and was a huge aha moment for me, is that 100% of these people, 100% of these people can benefit from grief literacy. So everybody, regardless of how at risk they are of prolonged grief disorder, can benefit from knowing how to support one another. And that's a really, really important point. So this is the model that we've been trying to test here in Canada, and I'll talk a little bit more about that. But I just wanted to touch on compassionate communities, because the whole idea of grief literacy comes under the umbrella of compassionate communities. And this is the Australia, they're doing a lot of good work. Compassionate communities grow connectedness and compassion, working together to create a supportive environment for those in need. Compassionate communities is a practice that openly encourages, supports, and celebrates caring for each other, during life's most testing times, especially those associated with life-threatening or life-limiting illness, chronic disability, being a carer, frailty, aging, dementia, dying, and grief. So it's their definition of it is lovely. And yeah, so I just wanted to touch on that. I want to kind of wrap up because I want to leave some time for questions and comments. So my number one thing is let's break the stigma. Let's open up the doors. Let's break the silence. And so I wanted to share a few resources that are my sort of my go-to, my ideas in order to do that. So ways to break the stigma that I'm involved in, we are running the study to test that model in Canada. Again, the protocol is, the way that we're doing that. We have done the survey already, and unfortunately, we're attacked by bots, but let's not get into that. But we are in the process of starting, we're in the process of getting ethics to start interviews. And the interviews that we want to do are the interviews with the people who are not traditionally heard in the grief literature. So basically, we want to be interviewing the folks who are not kind of the norm in the grief literature, which is the people who are like me, like white, cisgender, middle-aged women. So that's what we're going to be doing. I put the email there if you want to be in touch so that you can sort of follow along. There's a website as well. Listen to blogs. There's more on the next in a couple of slides. Social media, cartoons. We have a lot at Grief Matters. I put the link there. Another way that we break the stigma is to tell stories. So blogs and podcasts, social media, cartoons, all those things, they tell stories. And I just have to touch on, I can't resist ever sharing one tattoo story. This is a beautiful tattoo that honors the wearer's grandparents who grew up and lived for many years in the Azores, and so that's the traditional flower from the Azores, or the flower that grows wild in the Azores. And they grew them after they came to Canada. And this tattoo actually embodies continuing bonds because Angelina, who's represented by the butterfly with the name there, is alive. And so this tattoo represents continuing bonds in that it connects the living and the dead. So Angelina didn't meet her great-grandparents. And in this tattoo, Angelina's mother connects her own grandparents with her daughter. And there are so many lovely stories about tattoos that people are planning, the ways that tattoos honor people who have died. I can never resist sharing one, and it was really hard to pick one. There's just so many, and if you want to see more, you can go to Stories from the Skin. And more than that, other ways, the Canadian Grief Alliance and Canadian Virtual Hospice has just launched About Grief, which is, this amazing resource with all kinds of other resources and connections to other sites like Kids Grief and My Grief and that kind of thing. Grieving Children Canada and Disrupting Death, which again is your colleague, and there's a podcast associated with it, and digital stories and all kinds of things, and Canadian Hospice Palliative Care Association, and so much more. And hopefully we can generate a few ideas about that. So that brings me to questions, other resources if you have them, and I put my emails there. So I'm happy to answer questions now and in the future. If someone's watching this, you can email me, and if you have any trouble accessing any of the resources that are supposed to be available, I'm always happy to help with that as well. So I'm going to stop sharing my screen.
Susan, we do have a question in the chat about the importance of language, and they were wondering if you have an example of alternative language for loved ones.
The language that I usually recommend is using the person's name if that's appropriate. It's not always appropriate, and you might not know it, or the relationship. So I tweaked to the use of this when my father died. Um, he had dementia, and then he was in long-term care, and then he died, and I became very sensitive to it at that moment. And it would have been very, very easy for people to say your father instead of your loved one. In fact, it would be shorter for people to say your father rather than your loved one. So, if you can use someone's name, use their name. If you don't know, you could say the person that you're visiting, or the person who has died, or there's ways of getting at the relationship, to, like, as in familial, your friend, because we're not everybody's related um, um, by blood, and yeah, so there's just different ways. That's what I would suggest.
And are there any other questions from our participants today? You can raise your hand, or if you'd like, you can take yourself off mute.
Hi, I was just wondering, since I don't know much about this webinar, is this the first session today, or you guys already had a few sessions before already?
This is our first session today,
Okay.
Arisha. Yeah.
So then the next one will be in December, and then you guys will keep on updating the website?
Yes.
And then there will be 6 sessions in total every month?
6 sessions in total until the end of March 31st.
Okay, thank you for letting me know.
Can I just ask or make a comment?
Yes.
Okay, I don't know if my phone's going to die first, but just reading through some of the chats and that too, and it doesn't matter if any of our backgrounds are on the side burner, because there is a lot of grieving parents, and like you said, we don't have names for when we've lost our siblings, and it's a really hard thing to explain. And when you said, when you speak French, and I speak different languages, and it wasn't until I translated to somebody from French to English to say, it's not that they're like, I'm missing my children. Of course you're missing your children. Who doesn't miss your children, right? It is, they're missing from me. And in French, that's what we say, to mon manque. And I wanted to correct from you that it is, because you really are, they are missing from us. And I really appreciated that. It was how you explained the grief too, that, it began with like losing jobs and stuff because of, my health issues and stuff, but it was, that began for me too. So I'm very excited to be here, and I'm very looking forward to connecting with some people. So thank you.
Awesome. Yeah, that's a great point. And that's another thing. While I talk about loss as a as a way of speaking, I also think it's important that we're careful about the term "I've lost someone." For instance, because I wrote about my the friends when I was the friends who died in the 90s, the sort of my introduction to grief were gay male friends who were dying of HIV and AIDS at the same time as I was having children. So I was like, both ends of the life spectrum. And I remember saying that I lost friends because, you know, I lost friends when my children were born, meaning some of my friends died when my children were born, but other people often interpreted that as, oh yeah, those friendships that go away because they don't have children or they don't want to hear about your children or whatever, you got too busy or that. So even that term lost is, you know, is something that we need to be careful with. Nobody, you know, we didn't lose our person, they died. We are still connected to them. Yeah, so it's language that we just need to be careful about. There's lots and lots of language that we need to be careful about in this aspect. I'm looking through the chat and I'm very touched to see the number of people who are sharing their own grief. And you know, that's a really important point, that, you know, a community of practice is about professionals, and, you know, are human beings, and human beings experience death and dying and mortality. And we all experience grief at some time in our lives. And so even when we are professionals, it's really important that we not assume that we're not grieving as well. I remember when we started the grant process, and you know, that when we got funding from Canadian Institutes of Health Research, I was talking to someone about joining the team, and they said, like, the idea of having a patient representative, like, do we have grievers? And I was my response was, well, I'm grieving. Are you grieving? Because I think we're all grieving. So, you know, I think I understood the point that yes, we didn't have someone who's kind of, that was most of their preoccupation, rather than, you know, I am an academic who has experienced grief, although I experienced grief first. You know, it all goes hand in hand, and it's all intertwined. And it's really important that we not make assumptions about people who are professionals, because they may well be grieving as well.
Susan, there was, if we could take maybe one more question, what do you recommend to do to prevent long-term grief from developing?
Oh, that's yeah, talking about it and normalizing it. I think the risk is much higher when we're all quiet about grief. I always, you know, one of the kind of myths around grief is that people around the person who's the people who are around the person who's grieving shouldn't bring up with the case of someone who's died, they shouldn't bring it up because they might remind them. Well, the reality is that when you're grieving a significant loss, you are thinking about that. And if I bring it up to someone, the worst case scenario is that they say, today's not a good day to talk about it. The best case scenario is that it is a good day and that you forge a bond because you have identified yourself as a good person to talk to, and lots of lots of room in between. But you have signaled that you are an okay person to talk to, even if it's a bad day and it's not a good day to talk about it, right? So I think it's really important that we all break the silence, and that we all understand grief so we can recognize it in ourselves and therefore also recognize it in others. And the other thing I often tell people is not to be afraid to circle back. There are so many times where something happens in the middle of a conversation and somebody mentions something, and you know, I will circle back to things and say, you know, you mentioned that, you know, since the last time I saw you, your spouse died. You know, and like, say something about that. I'm also very cautious about that "I'm sorry for your loss" kind of comment, because like land acknowledgements, it often just rolls out like that's the thing we're supposed to say. But I gotta say, yours was really lovely, Jill. Your land acknowledgement didn't roll out just like that's okay, now we're done that one. And often "I'm sorry for your loss" rolls out like, okay, that's on the checklist. I need to do this or this, and I have to say sorry for your loss. And so, you know, I think it's about engaging in conversation. It's not about saying the thing that you're supposed to say.
Thank you so much. I know we had a couple more questions in the chat, but I'm very conscious of the time, and we do want to